Hala Almossawi, who's a senior TB and HIV advisor at USAID. Hala's been a public health specialist for over 20 years and has experience in professional development, project management, M&E and quality improvement. So over to you, Hala.
Thank you very much for the introduction. And before I start, I would like to thank the National Health Program as well as National TB Program from the National Department of Health in South Africa, as well as our colleagues from USAID South Africa and the implementing partners there for their inputs, as well as the opportunity to present on the experience in scaling up TB preventive treatment in South Africa. I will start with some key facts about the two epidemics in South Africa. Dr. Sahu, he presented a comprehensive picture about the overall, like for the global figures in South Africa. In 2016, over 124,000 people died because of TB. Of those, over 80% of those were infected with HIV. And out of the estimated 322,000 incident cases in South Africa in 2017, about 60% are HIV positive. So, as you all know, it's the leading cause of death in South Africa. I borrowed this figure from presentation in Durban in 2019, the recent one by Caprisa. And as you can see, Africa has 70% of all people living with HIV, with less than 1% of the world's population. South Africa has 19% of all people living with HIV. So you can see the top 10 countries, the 60% of the people living with HIV in these 10 countries, and South Africa is on the top of the list. The figure on the left shows the distribution of TB-related deaths in eight countries, with 27% in South Africa. And the two figures on the right, this is from WHO 2018 report, where you can see the TB preventive treatment in 2017 was over 50, I cannot see from this side, over 53%. People living with HIV, HIV positive people on TB, put on TB preventive treatment. This is a figure that shows the TPT target for 2020 and 2020 for the top 23 high burden countries, including the targets for people living with HIV. And as Dr. Sahu mentioned, that the target, the least that we should reach is 30 million people will be eligible for TB preventive treatment between 2018 and 2020. And the coverage, the global coverage was 36%. In South Africa was 53%. And with regard to the TB preventive treatment, in 2017, the 67 countries reported initiating TB preventive treatment for a total of less than 1 million, and South Africa accounted for 39% of the total. All of you familiar with this figure from Global TB report, and Dr. Richard also, he highlighted this report. I wanted to also show the trends in the annual number of people living with HIV was in 2014 less than 1 million and has subsequently leveled off, and unfortunately was little less in 2017. Again, South Africa accounted for the largest share, which is 39% of the global total. Now, with regard to the TPT policy considerations, as mentioned by the OOS 2017 report, all countries, they have TPT in their policies, and the challenges remain with the implementation. In South Africa, some background about the TPT policy. As you can see, the indicators, with regard to the indicators as well as the targets, interventions all mentioned across the process of care along the TB cascade, and South Africa is one of the countries with the largest number of people living with HIV that initiated TPT IPT, and TPT scale-up is driven by the National Department of Health that is very committed to end the epidemics, supported by TB think tank, as well as other stakeholders, PEPFAR, USAID, CDC, UNITAID, and the Global Fund, others. Previously, the previous policy on TPT, the guidelines was often cited by clinicians and difficult to follow, and included the use of TST to determine the treatment and duration. However, in May 2018, many of you who works in South Africa are very familiar with this circular that was circulated and now implemented in all sites, PEPFAR as well as non-PEPFAR supported site. As you can see, this is signed by the DDG, and it's now I highlighted the key points, but to address the complexity of the guidelines circular that was released, the new revisions include the universal expert testing for people living with HIV, including pregnant women on diagnosis to rule out active TB shouldn't delay the TPT initiation, and TPT should be initiated on the same day with ART if eligible. The duration 12 months for adults on ART, and now the Department of Health with other stakeholders in the process of updating the guidelines. Patients currently on ART with no prior TPT will be initiated on TPT if eligible, and TPT will be deferred in HIV positive pregnant women with no active TB disease until 3 months postpartum. Treatment options, with regard to treatment options, 3HP will be introduced with coverage to all 52 districts expected in 3 years. This is the geography of PEPFAR TB HIV support in South Africa for both USAID as well as CDC, and PEPFAR supports 27 out of 52 districts in South Africa. The 27 districts account for 80% of people living with HIV. 17 districts are USAID supported and 10 CDC. PEPFAR South Africa technical consideration include renewed focus on TB preventive therapy, and this is in the guidelines as well as the COP19 guidelines, and TPT requirement in COP19 planning letter, TB Prev to reach the target of 834,000, over 834,000, need to initiate 1 million patients on TPT. South Africa has demonstrated significant improvement over time on the number of people initiated on TPT, as you can see from these figures, and percentage of people living with HIV newly enrolled on care on TB preventive therapy. So the previous one, as you can see, a percentage of people living with HIV newly enrolled in care from 2016 to 2018. And this one is from the recent data from Q2, which is end of March 2019, where you can see the percentage of ART patients screened for TB for USAID partners increased, as well as a number of ART patients who completed TPT increased in Q2. Sean explained this cascade of HIV TB prevention, the cascade, where you can see, and this is Q2 data, which is end of March 2019. Over 90% of people screened, like ART patients screened for TB. 98% of those were negative. Unfortunately, less than 5% of those initiated the TPT. Of that, only 47% completed the treatment. So this is from the left side of the graph. And this is a figure illustrating the TB Prev program performance in PEPFAR supported site for all the districts, and my colleagues after lunch, they will provide more details about the progress in terms of performance, as well as barriers, best practices and results from the sites. With regard to the scale-up plan and the programmatic TPT scale-up, and the approach is to, first we started with establishing the TB-HIV special interest group, CIH, to drive the implementation as well as a scale-up of effective interventions. Also assisted in the development of the TPT work plans and guidelines to ensure the implementation of the same interventions at the same time by all partners. Joint PEPFAR and DOH meetings, very good collaboration with the National Department of Health at the national, provincial, as well as district level. Development of tools, as Sean mentioned, and elaborated on all these tools that are currently implemented and used by partners. Weekly monitoring of partners' performance on TPT initiation and completion, as well as engaging provinces during their partners' meetings, besides the technical assistance provided during the site visits, regular site visits by the agencies as well as implementing partners. This is more kind of summary barriers from South Africa. Sean maybe provided the overall barriers. Our colleagues will give more inputs from their experience, but in general policy issues, which is the provision of TPT for patients on ART in differentiated care. Some challenges remain with the supply chain, a lot of opportunities. The main opportunity in this country specifically is the great commitment of the National Department of Health. Is very committed, and they are committed to end the epidemic, and also they put a lot of resources and efforts and collaborate with others to make sure that it's targeted as a comprehensive approach to the implementation. So the opportunities is the introduction of DTG. All patients initiated should also given TPT if eligible. Monitoring of outcomes, the opportunity to monitor all outcomes in addition to completed. The focus on the completion is very important. And the 3HP, as Karen mentioned, everyone now is really focused on making sure that this 3HP is introduced as well as rolled out in South Africa as well as other countries. So the main message, whether globally or in South Africa, the progress encouraging. However, in countries like South Africa, there is a need to act with urgency in order to meet the target of reducing TB deaths among people living with HIV by 75%, which is the target for 2020. It's really approaching, and we are calling on urgent action to ensure that all people living with HIV and TB have access to effective prevention and treatment services in order to stop new infections and save thousands of lives. Thank you very much.